For this video, I will cover the most common types of depression and how it can be treated or managed without medication. Occasional sadness is a normal part of life. For example, you might feel depressed when someone leaves you that you love, when you lose your job, or when you are not taking care of your own body. However, depressive disorders involve more than a temporary lack of interest in activities or depressed mood due to negative circumstances. For a person with a depressive disorder, the depression usually lasts consistently, at least 2 weeks or more, and returns without warning. This cycle repeats over and over again until the person suffering seeks out some type of intervention to control it. Depression can become chronic or recurrent and can lead to substantial impairments in daily living. There are several types of depression and severity levels. First, I'm going to talk about major depressive episodes. Symptoms include depressed mood, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep, changed appetite, fatigue, and poor concentration. At its worst, depression can lead to suicide, which averages about 850,000 lives each year, just in the United States. Next, I'm going to talk about persistent depressive disorder, which can be called dysmethia. This is a problematic disorder purely because it's relatively mild and people tend to think it's partly part of their personality, rather than suspecting that they may be suffering from a disorder. The main criteria that distinguishes this disorder from other forms of depression is the fact that the diagnosis requires at least 2 years of persistent symptoms without a break of more than 2 months. The last disorder that I will be discussing is postpartum depression that occurs only in women. Symptoms usually range from about 24 hours to a few months after the baby is born. Common symptoms that differ from basic depressive disorders are decreased interest in sex, feeling rejected, frequent crying, and weight loss. Psychotherapy can be done both in groups and one-on-one with a therapist. The type of therapy that will be most effective for you or your loved one will depend on the different types of depression and the underlying causes. In some cases, interaction with others suffering with the same problems can be useful. However, in severe cases, it can be overwhelming and counterproductive. One approach to defeating depression is known as cognitive behavioral therapy. Depression is maintained by constant negative thoughts that are automatic without a conscious effort. For example, a depressed person might have automatic thoughts like these: I always fail at everything, or I'm the world's worst mother, or I am doomed to be unhappy forever. Every automatic thought gets distorted or exaggerated in comparison to the reality of the situation, which fuels the depression. If you try cognitive behavioral therapy, you will learn how to recognize and correct negative automatic thoughts. Over time, you will be able to discover and correct these false beliefs that contribute to the depression. To sum it up, it's not the power of positive thinking, it's actually the power of realistic thinking. Acceptance and commitment therapy is another type of therapy for depression. Essentially, ACT or ACT looks at your character traits and behaviors to assist you in reducing avoidant coping styles. ACT also addresses your commitment to making changes and what to do about it when you get stuck in your goals. Diffusion is another aspect of ACT that teaches how to cognitively diffuse heightened experiences. Diffusion involves realizing thoughts and feelings for what they really are, like passing sensations or irrational things that we tell ourselves. The goal is not to help you avoid the experience, but to make it more manageable for you. Another approach is called interpersonal therapy, which is a short-term treatment addressing interpersonal issues with various relationships, including family and peers. Therapists work collaboratively with you, either individually or in a group, to identify one or two significant problems within the interaction process. The overall goal is for you to become more aware of your ability to deal with interpersonal problems that have kept you from being able to actively manage your symptoms of depression. Lastly, I will highlight the adjunctive self-help treatments that you can incorporate in your daily life. First, pay attention to the amount of exercise you accumulate per week. Second, your diet regimen. And third, your relaxation or spiritual time. By initiating healthy lifestyle changes, you will notice drastic improvements in your thoughts, mood, and daily functioning, while also enhancing the benefits of therapy. To learn more from me, just sign up to receive my free newsletters that can be sent directly to your email every month. Please contact me through visiting my website at jenniferhillcounseling.com. You can post questions you have or book a counseling appointment. Thanks again for watching, and stay tuned for next month's topic.